I am Dr. Erin Bravo, and my specialty is breast imaging radiology. When a patient is considered high risk for developing breast cancer, that basically means that they have greater than a 20% lifetime risk of developing breast cancer. So currently here at Advanced Medical Imaging, we are trying to identify patients that are considered high risk. So patients that have greater than 20% lifetime risk of developing breast cancer. Factors that make a patient at higher risk for developing breast cancer include if they have had a personal history of breast cancer, or if they have had a personal history of high-risk lesions such as lobular carcinoma in situ or atypical lobular hyperplasia. Also, another big category for making a patient at higher risk for developing breast cancer would be family history of breast cancer, any cancer actually, and patients that have a family history of breast cancer in folks that were younger than 50 years old. If a patient has had radiation to the chest between 10 and 30, this increases their overall lifetime risk for developing breast cancer. Some additional factors that will be evaluated here at AMI include breast density. So patients that have higher breast density in the heterogeneously dense or the extremely dense breast tissue, these patients tend to be at a slightly elevated risk for developing breast cancer. So at AMI, we will evaluate an overall lifetime risk for developing breast cancer. The LB 195 is new legislation that allows us radiologists to inform patients when they have higher breast density, either heterogeneously dense or extremely dense. These higher breast densities are very normal, and almost 50% of the population will have either heterogeneously dense or extremely dense breast tissue. So it's not an abnormality, it's a normal finding. When patients come in for their screening exam and they are found to have a higher breast density, then they'll receive a letter in the mail saying that you have a higher breast density, and just encourages them to discuss with their physician other screening options that may be best for them. We are currently doing 3D screening mammograms here. The 3D mammogram really helps us to see through the dense breast tissue. It's really helping us to find abnormalities that are hidden. In regards to overall breast health, I encourage patients to know their family history and to help them determine if they are at higher risk for developing breast cancer. Typically, in a patient that is at average risk, we would recommend patients starting screening mammography at the age of 40 and having a screening mammogram every year. In patients that are at higher risk, we may recommend that patients have a mammogram starting at younger than age 40 because of their family history. And also, if a patient is found to be at elevated risk, then we would recommend also that the patient have a yearly screening MRI in addition to a yearly screening mammogram.